Hi guys, this is Dr. Aditya Bapuji, your family physician, certified in rheumatology from Pune, immunology from Harvard Medical School, and diabetes management from Apollo Hospitals, Hyderabad. I am a family physician working at Center for Integrative Medicine, Road number 10, Banjara Hills. So today here I have been wanting to discuss some very interesting and common issues that are actually very simple and easy to deal with, but unfortunately, because of patients' experience, it becomes all the more complicated. So I'm here to talk about lower back pain. I'm here to talk about neck pain and some medical myths that usually patients have, concerns about. So now, as far as lower back pain is concerned, see, lower back pain or lower back issue is just a symptom. It is not a disease. In 90% of the cases, lower back pain is because of mechanical issues, mechanical stress on the spine. Only in 10% of cases, a disease is the reason for lower back pain. And lower back pain presents in very different ways, or a lower back issue rather, presents in very different ways. So lower back pain can be confined. It can, radiate down to the hip. It can radiate down up to the thigh. It can radiate down up to the foot. It can cause tingling and numbness in areas where the nerve is supplying. So it can cause burning sensation. It can cause problems otherwise, which I'm going to discuss about in detail. See, understanding the pain is very, very important. The pattern of pain, the intensity of pain, because these things are very, very important. Now, in my experience, a lot of patients who end up at my clinic already have got a lot of investigations done and have undergone a lot of, are mentally stressed because, at some point they would have been advised surgery they also perceive that particular advice as the ultimate solution for lower back pain or whatever pain that is persistent because of a lower back issue. That is not true. Now, see, lower back is a very complex structure. It has got vertebrae, it's got bones, it's got muscles coming and attaching to it, it has got ligaments, it has got a lot of nerves that supply to both the legs. So it's not as simple as it is, or it is not as simple as it seems. So see, in most of the cases, see, the very reason why I have come up with talking about lower back pain today is I've been coming across a lot of cases where there have been opined surgery. So it is very important to understand when surgery is required or when extensive evaluation is required. See, a lower back pain or a radiating pain or related symptoms, if they are not constant, where lower back pain is varying with postures. Some people experience it only on sitting for a long time. Some people experience it when they have when they are standing for a long time. Some people, they experience it only when they walk. So when the pain is inconsistent, there is absolutely nothing to worry. That is something very important. And if the patient is able to stand on toes and heels equally, then he is not a case for surgery at all. That is one. If the pain is constant 24 hours, where there is absolutely no relief in pain, in the intensity of pain, on lying down, on taking bed rest, or change in postures, definitely it requires extensive evaluation. That is a red flag. Secondly, if the patient is not able to stand on toes and heels, that is also a red flag. So that is the best way to test is, you can take support of the wall or whatever is there close to you. Take support and just try and see if you are able to stand on toes and with your heels up, and if you're able to lift your heels equally, then put the heels down next and try and raise the toes up. So if you are able to raise the toes equally on both sides, and if you are able to stand on your toes with your heels up equally on both sides, there is absolutely nothing to worry. You're not a case for surgery. Thirdly, there are some red flag symptoms that we usually ask for, and the patient also should watch out for. So the red flag symptoms basically include a loss of bowel and bladder control. If a pain has started and it has, very quickly progressed into a neurological issue where there is absolutely no control of the bowel and bladder, it is a red flag. Secondly, if the patient is experiencing difficulty in emptying the bladder, where there is a delay in emptying the bladder, along with a lower back pain, which has progressed into something like the symptom that I just described, then that is definitely a red flag. Thirdly, if there is tingling or numbness on the penis or on the tip of penis which is consistent, it is not varying with postures, that is a red flag sign. And most importantly, kidney issue also has to be ruled out. Usually kidney issues, or I would rather say a urological issue, will present as urine that is, the patients may pass red colored urine. So that is a red flag sign that will need extensive investigations. But otherwise, if you don't experience any of these symptoms, and if you are able to stand on toes and if you are able to stand on heels, you are not a case for surgery. Thank you.